Good afternoon, everybody. Thank you very much for coming in today. I'm Jeff Yerrick, MPP, Elgin Middlesex, London, and the new PC Health Critic. With me today is our Associate Critic, Bill Walker. I want to start by thanking the Auditor General for her work on this audit. That being said, there are some alarming facts here. The Auditor General of Ontario's report highlights that the Wynne Liberals need to take urgent action to address the poor state of our home and community care sector. It also confirms the Donner report and Gail Donner's comments that the healthcare system is dysfunctional. This is a number one issue that many of our members throughout the province hear about every day in the constituency offices. The report shows that home care is the cheapest method of care, $45 a day compared to 10 times that in the hospital bed. Knowing this, the province should be treating home care as its first resort, not its last. Funding for home care has stagnated at roughly 5% of the ministry's budget, despite its potential to save the province millions and provide better care for Ontarians on their terms. The Liberals have implemented 3 new programs in 2011, forcing CCACs to hire nurses without any idea of the cost. The Liberals have done this without knowing how much it would cost or without any idea of how effective it would be. It is evident that the Liberal government's policies were not effective, as 47% of people are not receiving the care they deserve. This is yet another example of how this government barrels ahead with new programs without giving thoughtful consideration before implementing. You can't do that with people's health. When asked why patients weren't getting the care they need, one CCAC stated that this standard is not always met because patients are discharged on Fridays and there's no nursing coverage on the weekends. Healthcare is not a 9-to-5 job. The report also revealed that only 61% of CCAC dollars go to face-to-face care. That means 40% of the budget isn't going to healthcare and instead going to administration and bureaucracy, such as the 72% increase in the salary of Champlain CCAC CEO since 2009. Meanwhile, Eric Law, a patient with multiple sclerosis, diabetes, a thyroid condition, and cancer, is told he won't receive care because of budget constraints. The Champlain CCAC feels Eric Law is just not sick enough, while the CEO receives a 72% raise. Ontario is blessed with dedicated nurses, doctors, and other frontline caregivers, all of whom work hard to do what's best for their patients. Unfortunately, as a result of the Liberal mismanagement, our home and community care sector is failing the province's most vulnerable. We need to take an approach that puts patients first, not administrative waste or lack of accountability at the center of decision making. It is time the Wynne Liberal invest in the health of Ontarians and makes patient-centered care a priority. Thank you, and I'd be happy to take any questions.
In the health critic role, Christine Elliott was a very strong advocate of scrapping the entire CCAC system and creating health hubs. Is that something that you think this report sort of lends credence to?
Well, what's going on with our party with regards to that is we're undergoing new policy development. We have a new leader, Patrick Brown, which has set us on a new direction. We have a policy AGM coming up in March where we'll set the ball rolling as caucus and as members of the PC party will develop policy. Obviously, this report speaks to the fact that the current management of the CCACs is dysfunctional and needs to be addressed.
Jeff, what's the most disturbing thing you read in this report?
Well, the fact that up to 47% of people aren't getting the immediate rapid response when they transition out of hospital. I think that's a critical time for people to adjust to care at home, to keep from rehospitalizations from occurring. And if they're not getting that care, there's more likely heading back to the hospital, which is just increasing the cost and not accessing their care.
What do you think is an appropriate percentage to be spending on the bureaucracy side of things?
Well, you look at 40% of the healthcare dollar that's going to CCACs is heading towards the bureaucracy and administration of CCACs. Yes, the average Ontarian, what they would think would be an average number, and they'd probably say 5 to 10. But however, as a party, we'd have to look at what exactly a target number for the CCACs to make. The government cannot allow CCACs to make that number up on their own and decide how much money goes into the administration. Government should take a leadership role and come up with a certain range for them to administer their programs.
The province talks a lot about its home care first strategy. Do you think it's working?
Province has had 12 years to monitor and make changes to the home care system. It's taken an Auditor General's report to actually get them to actually respond and come forward. If you look at the home care first, as I mentioned earlier, 5% of the home care healthcare budget is spent on home care. That's a number that's maintained pretty much the same over the last 10, 12 years. If you really want to make home care a more crucial part of the healthcare system, you think that pie would be growing, as it is a cheaper, more effective way to ensure proper healthcare savings and also efficiency in the system.
Any more questions? All right, thanks everyone.